Hi, my name is Jennifer Helbig. I'm a nurse practitioner at Orlando's Pediatric Clinic. I have a 17-year-old female patient. Her name is Julia Smith. She came into the clinic this morning complaining of some pretty severe abdominal pain that started about 3 days ago. So her abdominal pain started in her back, and it has now progressed to her right lower quadrant. It's pretty severe because it's affecting her sleep and her ability to walk upright. She does report that she has experienced pain similar to this in the past, and it's been associated with her menses, but never to this extent and this severity. She says that her last period was 3 weeks ago. She is sexually active, and she does have a personal and a family history of menorrhagia. Yesterday, she did have one episode of a non-bloody, non-bilious emesis, but denies any diarrhea, fever, or any other urinary complaints. Her past medical history is negative for any chronic illnesses, prior kidney stones, or surgeries. She's not currently taking any medications or supplements, and she is up to date on her immunizations. She is 82 kilograms, and her vital signs in office today were unremarkable. On exam, though, her abdomen was soft, but it was pretty tender in that right lower quadrant, but there was no guarding and no rebound tenderness. A rectal exam was performed. It was normal, and a hemocult came back negative for her. We did run a urinalysis, and it did show blood 3+ with some red blood cells in there, but that's it on the UA. We did also run a CBC and a CMP. So her hemoglobin was fine. Her white count was elevated at 15,000 with an 80% neutrophil shift. And her CMP was unremarkable. We did get a pregnancy test in the office, and it was negative as well. So for my assessment, I believe that Julia has nephrolithiasis. The severity of her pain, the movement of her pain from her back to her lower right quadrant could indicate a stone and its movement through the urinary tract. Her episode of vomiting and the presence of hematuria on the UA outside of her menses is also consistent with this diagnosis. I'm not as concerned for appendicitis because, her pain started in her back. And there's no guarding and there's no rebound tenderness. So I'm not thinking that it's appendicitis. We ruled out a possible ectopic pregnancy with her negative pregnancy test. It could be pyelonephritis. There were no white blood count but there was no white blood cells, nitrites, or leukocyte esterase on her or in the UA, and she's afebrile. So I'm not convinced that, she has this diagnosis. So I think that ultimately she should be worked up for nephrolithiasis. So my recommendation for Julia, I think that she should be admitted to the ED for some imaging, IV fluid hydration, and some pain management. Her pain is severe, and I think she needs some pain control aside from what's available over the counter, like ketorolac. She needs a renal and a bladder ultrasound to help identify the stone. If we're still thinking a potential ectopic pregnancy or appendicitis, we could always do a pelvic ultrasound at the same time while we're doing a renal and a bladder, just to rule it out and just make sure that we don't have ovarian torsion, an ectopic pregnancy, or appendicitis. If we are not able to visualize the stone on ultrasound, we could always get a non-contrast CT, but we'll start with the ultrasound first. And then she will need to be educated about increasing her fluid intake, whether she's going to be passing the stone or not. So intervention will really be based off of, the size of the stone and if it's obstructing any part of the urinary tract. And from there, we can send the stone off to pathology so we can see what it's made up of and kind of tailor some of our dietary education more for Julia. So she should be educated on avoiding oxalate-rich foods because that's commonly a cause of stones, being careful of her salt intake, and avoiding a high-protein diet. Even though most stones are made out of calcium, she should still get good sources of calcium like milk and yogurt in her diet, and also citrus is good to help avoid stones. But ultimately, once she gets discharged from the hospital, she should follow back up with us here in the clinic to see how she's doing and then just reinforce this education. Do you have any questions?